So how do we diagnose dermatomyositis? This is something that I really like to talk about, maybe in a biased way, as a dermatologist, because really doing a thorough skin examination that is targeted to know what you're looking for is, I believe, far and away the best way to make the diagnosis of dermatomyositis. And because dermatomyositis can affect some areas like we discussed, such as the upper eyelids, such as the upper outer thighs, it's really important to know what you're looking for. That in some patients can be very apparent. In other patients, you need to know to ask them to close their eyes to take a close look. You need to ask them to get in a gown to examine an area such as their upper outer thighs. And so looking carefully at these findings, knowing what you're looking for, is the best way to make the diagnosis, in my opinion. And those manifestations can range from really subtle to sometimes exaggerated findings, and the diagnosis can be really easy in cases where you know what you're looking for and the findings are exaggerated. And it can be more challenging in patients with subtle manifestations. In terms of things that can support our diagnosis, most of the time we're doing a skin biopsy. The reason that is not something I rely on for diagnosis exclusively is because we will see findings that can be seen in other autoimmune processes of the skin, such as lupus. The biopsy findings may be identical. And so if we ask the pathologist or the dermatopathologist, is this lupus? They may look at that same slide and say, yeah, it's lupus, because that's what it looks like. If we ask them, is this dermatomyositis? The answer is the same. Yes, that's dermatomyositis. The findings essentially are the same between those two conditions, and some other conditions can really mimic them under the dermatoscope as well. Dermatomyositis is a heterogeneous disorder, meaning it can present in a variety of ways. Fortunately, though, there are some characteristic findings that allow us to make that diagnosis really just by examining a patient. And usually a good skin exam can be all that's needed to make the diagnosis of dermatomyositis. And that's because of some of its relatively classic manifestations. So what happens to the skin in dermatomyositis is typically an itchy rash. The rash affects some classic areas like the extensor surfaces of the hands. The hands are one of the areas that can be the most telltale in terms of making the diagnosis of dermatomyositis. Patients can get what's called Gottron's papules, which are pink or sometimes purplish patches overlying the knuckles. And then some of their cuticles have some changes as well that can really indicate that disease process. The other areas that tend to be affected are upper eyelid margins. And the scalp is also very affected in terms of an itchy and scaly rash that can occur. The sun can provoke it. And that means that areas that tend towards more sun exposure over lifetime also tend towards development of that rash. And so that means that we get a rash on the chest, the upper back, the outer arms, and those are very classic sites for dermatomyositis to affect. For some reason that we're not fully aware of, dermatomyositis tends to affect extensor surfaces, like the skin overlying the knuckles, but also therefore the elbows and the knees. And then we also can see, similar to the malar rash of lupus, erythema that's occurring on the cheeks of patients, more on the mid-face than what we see in a lupus patient. And that can sometimes cause confusion in terms of the diagnosis, but seeing redness on the cheeks is very common in patients as well. It can occur on other sun-protected sites, like the upper outer thighs are a really common area to see a dermatomyositis rash as well.